Welcome to Don't Ask That Question. I'm Kelly O'Mara. Today we're talking with Greg Glaser, who is a vaccines rights attorney in California and lead counsel for the control group. It's a pilot survey of unvaccinated Americans who filed a federal case to support the right to remain unvaccinated. He also is general counsel for Physicians for Informed Consent. Greg fights for those who believe they have a right to decide whether or not to get vaccinated and who believe they have a right to informed consent about the risk and benefits of any vaccine being proposed. Welcome, Greg. Thanks so much for coming on my show. I appreciate it.
Yes, Kelly, thank you for having me here. I'm pleased to talk about this very important issue.
So, look, I guess the first thing I'd like you to do is kind of explain what the control group is, when it started, what was, what's entailed in it, and then we'll get into some data.
Sure. So a control group is a scientific group that's set aside when comparing a product. So for example, if you want to compare people who smoke cigarettes to those who don't smoke cigarettes, the control group is the people who do not smoke cigarettes. It's the same for vaccination. A control group is individuals who have not received a vaccination. The way that control groups are conducted by pharmaceutical companies is they will give vaccines actually to the control group, but they won't give the vaccine that's being studied. So for example, a pharmaceutical company will, if they want to study HPV vaccine, they'll say, okay, we're going to look at girls who've received every vaccine on the CDC schedule to girls who've also received every vaccine on the CDC schedule except for the HPV vaccine that we're studying. And then they will compare, well, do these girls have the same rates of illnesses? And then if they have the same rates of illness, then they say that the vaccine is safe. However, the control, even though technically, even when they did that HPV study, they still gave girls, when they did, for example, they looked at the third HPV, they still looked at girls who had had 2 HPVs. They call that a control group. So the pharmaceutical system is very flawed. I'm going to be talking about something totally different, meaning the right way to do a control group, because that's what my group did.
Okay, so let me stop you there real quick. Okay, so you're saying that pharmaceuticals don't have a control group that's using just saline.
Correct.
They're actually using a different vaccine than the one that is being tested.
That is correct. We proved that in our court documents. We showed that for every single vaccine on the CDC schedule, there has never in the history of vaccine licensure used a saline and never vaccinated group. They always categorically, the pharmaceutical companies always categorically take vaccinated people and put them in a group and call that group a control group. And those vaccinated people receive many vaccines, and including previously licensed vaccines. And that's how the whole system is rigged against genuine control groups.
I mean, I'm not sure how are they allowed to do that? Aren't there, I'm just kind of curious here. I thought there were like standards, scientific standards for, testing and clinical trials. And it's okay to use, the HPV vaccine in the control group, and you're actually testing for encephalitis in the vaccine group.
Yeah. That is, yeah, it's a rigged system. And the way that they got away with it for the first HPV vaccine was because girls had not received the HPV vaccine because it just came out. So what they did is they used what's called the carrier solution, which has aluminum in it. And so there's the vaccine itself, which is like a vial, and it's filled with all these ingredients.
Right.
Okay. So you have like maybe 10 ingredients, let's say. And then in the control group, they give the exact same vial, but it's just missing one ingredient. So the girls still get the 9 other ingredients called the carrier solution. And they say, oh, well, that's the control group. And as long as both sets of girls have the same number of injuries, they all develop the same number of neurodevelopmental disorders, of autoimmune diseases. And they say, oh, the vaccine's safe because everyone was hurt the exact same amount.
Wow.
Yeah, it's flawed. I mean, and if cigarette companies did this, it would be a laughing stock. It would be a joke. Everyone would see through it. You'd say, how could a cigarette company compare people who smoke 20 a day to people who smoke 19 a day. Like it doesn't make any sense.
Right. And so there aren't any regulations. I mean, that's typically okay, no problem. Nobody in the federal government questions it, and that's fine.
Yeah, that's how they've been doing it for decades. They love their system, and it works for them because it always produces the results that they desire. They desire to license vaccines and sell them to people, and it's a liability-free product, meaning the pharmaceutical companies have no incentive to make their product better because they cannot be sued for any injuries that the product causes. Vaccines are classified under law as unavoidably unsafe, meaning the government realizes that vaccines will injure a certain number of people. They don't know how many people. They just say, well, it's going to injure some people. Therefore, because we all want vaccines, we're going to give these pharmaceutical companies complete immunity from lawsuits. You cannot sue them. If you do get injured by a vaccine, we're going to set up a special program called Vaccine Court, where you can get paid by the U.S. taxpayer for your vaccine injury. And that court is itself flawed. They don't have real judges. They limit evidence. They have these expert witnesses who are just rotating experts for the government who deny claims. It's a
And the burden of
travesty.
proof is on the injured. The burden of proof is on the injured.
That is correct. To show causation, to show that their injury was caused by the vaccine.
Well, what if you get the MMR? I mean, that's 3 vaccines in one. How do you prove which one it was?
You would just have to prove that it was that particular needle is what caused the injury. So if the MMR are all in the same needle, as long as you show that it was that needle that caused the injury, then you can recover some compensation for the injury. But books, for example, by Wayne Rhodes and Mary Holland have exposed that somewhere less than 1% of people get compensated for anything even near their injuries. The whole system is rigged to get people to settle for very low amounts, and it takes years to get even those settlements. It is it's an inherently flawed system, which is not surprising. People are just seeing this for the first time with COVID. They are seeing, oh wow, this public health system is very flawed. It's clear that public health authorities are biased in favor of vaccination. Mm-hmm. They're not promoting the interests of the people. Well, it's the exact same for every other vaccine.
Right.
In the same way that Fauci made it so that ivermectin was not allowed to work. They motivated the media to say ivermectin does not work. They motivated the public health institutions to say it doesn't work. They even did rigged ivermectin studies where they overdosed people with ivermectin to say that it doesn't work, even though there is meta-analysis and other far greater amounts of studies showing it does work at proper dosages. So it just goes to show that there's this inherent flaw in the public health system that the public health authorities don't want to change. And this is not surprising. This is how it always is in any industry. Whether you're studying oil and gas, you're studying vaccines, you're studying some other consumer product, the change never comes from the industry itself. They like business as usual. They like their massive profits. And it's the same with vaccines.
Well, in the case of the COVID vaccine, there really wasn't a control group because they vaccinated everybody out of benevolence. So
that's correct. Yeah, the study only went for about 2 months.
Yeah.
And so they looked at short-term safety and efficacy. And what they found is that after 2 months, they liked the results, and so they vaccinated their control group. So there could be no long-term analysis of the of vaccine injury.
Well, there is a control group, though. Actually, the control group are the people who didn't get it.
Yeah, correct. The control group is existing in society, and so the responsibility comes to private surveyors and doctors to gather groups of patients together and ask them about their health. But people who are unvaccinated don't want to get the vaccine, meaning that the way that pharma normally works is they say that if you want to participate in the study, you have to agree that you will get the vaccine if you get randomly chosen. So for example, Kelly, imagine that I said to you, I would like you to participate in a control group study.
Mm-hmm.
You say, okay, tell me about it. I say, okay, well, you can't know whether you're in the control group or not. It's the only way we can do science. Therefore, if you want to be in the control group, I'm going to flip a coin. Heads, you get the vaccine. Tails, you don't, but you're not going to know. You would
Oh,
say, heck no, I'm not participating in that study. That's dangerous to me because you know the danger of the COVID vaccine. So it's the exact same situation today. And why pharma, who rigged the system, they say, oh, well, we're not going to listen to any surveys or any just like, just asking people about their health, the unvaccinated. The only thing we recognize is that coin flip example. Unless you can get 10,000 people together and they will all agree to get the vaccine and do this all through a peer-reviewed,
right.
published study, we're not going to recognize it. And so that's the current situation.
Wow.
That is, yeah. However, there are groups, including my own group, that has done a survey, a health survey of completely unvaccinated Americans. And we completed this survey actually before COVID. It's called the Control Group. And we looked at actually all of the vaccines. So the MMR, the varicella vaccine, everything on the schedule. And then we compared people, children and adults, who had never received a vaccine in their entire lives. They're out there. They're actually completely unvaccinated people. And they're not just Amish. They live amongst us. They go to Target. They they go to school. Even though it's difficult to go to school in California, for example. And so we use the same methods, same scientific survey methods used by the United States Census to survey children's health, meaning that you send a questionnaire to the participants in your survey. You call them or send them a questionnaire and you ask them questions.
Right.
Tell us about your health diagnoses. Have you ever been diagnosed with diabetes? Do you have any neurodevelopmental conditions? List your conditions and then tell us how confident are you that your answers are correct on a scale of 1 to 10. It's the same method used by the United States Census to do health surveys that set national policy. So we just use the same method. And what we found was extraordinary. We found that, and if I can share my screen, I can show you some of these results.
Yeah. Let's see some of these docs. Because first of all, I want people to know that your website is vaxcheckers.com.
Yeah.
And I highly recommend everyone.
Vaxcheckers.org.
I'm sorry, .org. And go to this website because you're going to be fascinated by what they came up with this survey. So walk us through this.
Sure. So we surveyed 1,260 children. That's here. That's this group here. And then we compared it to national data of vaccinated children. So vaccinated children suffer minimum 27% chronic illness in society. That's like things that make life really hard. Childhood diabetes, childhood cancer, neurodevelopmental disorders like epilepsy. But the unvaccinated have very few of these conditions. The blue group is the group that has never received a vaccine in their life. Their mother was never vaccinated during pregnancy. They never got a K shot. The yellow group is the group whose mother was vaccinated during pregnancy, or the child was given an aluminum shot at birth called vitamin K.
Okay.
So what we found is that in the unvaccinated, there's precisely 0 children who have multiple chronic conditions in that perfect blue group, whereas it's about 7%, 6.6% for the vaccinated group. And same for just one chronic condition like diabetes. And then for adults, it's the same, it follows the exact same pattern. Here you have more than 60% actually of adults have at least one chronic illness: diabetes, heart disease, cancer. Whereas in the unvaccinated group, the number is approximately 5%. So whatever the unvaccinated are doing, it's correct. And then when you get to 2 chronic conditions, adults who have multiple chronic conditions, the number is even better for the unvaccinated because they have less than 1% have 2 chronic conditions. And then 5 chronic conditions means you're dying. And 12% of American adults are currently dying with 5 or more chronic conditions, whereas you can't
Wow.
even find that situation among the unvaccinated. So
Wow.
we calculated the odds this could just be by random accident that the unvaccinated are so much healthier. And the odds are 1 in this number. So it's 1 with 63 zeros at the end of it, which
Wow.
this means to anyone who's with a brain, it means that vaccines are causing chronic illness, because you're more likely to win the lottery twice, on the same day you get hit by lightning, than for this to all just be random accident. Because
So
our number.
let me ask you a question though. What would Fauci argue about your study? What would he argue?
He would argue a couple things. Number one, this is a self-selective survey, so it means that participants, the unvaccinated people, so this group here, this green
Uh-huh.
group or this blue group, that they selected themselves to participate in the survey, meaning that we made the survey available to anyone in the nation, but because anyone can join, then that means people can self-select themselves to participate. By contrast, the US Census, you can't call the US Census and say, hi, I'd like to participate in your health survey. Rather, the US Census calls you just randomly. So it's just this random group that you never know. So that would be one of his criticisms. Another criticism would be this data does not look at medical records. So these are mothers reporting the injuries or lack of injuries, the health of their children. And
Right.
so, how accurate is it? Well, previous studies have shown that it's above 98% accurate, the mother's reporting. So, and again, it's the same, we use the same technique as the US Census. And we also had our documents and evidence verified by multiple expert witnesses. PhDs, MDs, they verified that our methods are valid and standard. So here's an example. Adults, heart diabetes, about 50% of all adults have heart disease at some point in their life. We
Who
couldn't
have
even
been
find heart
vaccinated?
disease.
Who have been vaccinated?
Correct. The vaccinated group is always the orange, and
Okay.
the green is always the unvaccinated in
Okay.
our survey.
Okay.
Diabetes, same thing. So what this shows is diabetes cause vaccines. Vaccines cause diabetes, because if you were to survey 1,500 people like we did, and you found nobody has diabetes, even though in the background rate, 10% should have diabetes. That means we should have had 150 people with diabetes in our study. If vaccines don't cause diabetes, we should have seen 150 cases of diabetes. But instead, we found 0. So what does that mean? It means that you would have to flip a coin 150 times and it comes up heads every single time for that to be just a random flip. So
Yeah,
what are
yeah.
the odds of that? That's
Yeah.
1 in 64 with 68 zeros at the end of it. That's like astronomically high,
Wow.
meaning that every rational person understands vaccines cause diabetes. This is not like there's a correlation or like a maybe here. This is a causal causation. Every single thing we looked at followed this exact
Okay,
same
so
pattern.
wait a minute. You say if vaccines cause diabetes, then anybody who's had vaccines should have diabetes.
The answer is that vaccines cause the conditions that lead to diabetes,
Oh, I
meaning
see.
that there will be some people who are pre-diabetic, others who, even though they're vaccinated, are able to, avoid that autoimmune disorder that causes diabetes. And so, but what we find is that overall, you get something. Everybody who gets vaccinated gets some issue. And this number, 60%, that's us being generous based on national data. The number is significantly higher. In fact, Kelly, if you think about all of the adults that you know in your life, think about all the adults. You could probably only on one hand name the ones who are perfectly healthy, meaning no conditions whatsoever. They don't have allergies. They don't have neurodevelopmental disorders, no autoimmune disorders, never cancer, never never had diabetes, digestive disorders, eczema, asthma, food allergies, anything. You could probably count them on one hand because that's the situation. Everybody has something. All of us adults have something because we all got vaccinated. But this is the remarkable thing. You see it in the Amish communities, and you also see it among the never vaccinated. These people, it's like they took a time machine back to the 1950s when everyone was healthy because they only have the background rate. This rate, this 5.7, this was the same chronic illness rate in the 1950s. Because,
Wow.
yeah, it's like if you don't get vaccinated, you don't get these lifetime disorders that make life hard. And I mean hard. If you have diabetes, you have to change your diet. If you have a digestive disorder, do you know what it's like to live life without eating bread? You know how hard that is? Like, or to live life, with heart disease? It is, chronic illness is no like, oh, well, everybody's got something, who cares? No, this is serious. This should be ultimately nation changing, meaning that if public health authorities were honest in looking at this data, they would immediately change course. They would repent, they would atone, they would immediately change the vaccine paradigm. But they have no interest in doing so. For
Because
the
there's
same
too
reason
much
they
money.
have, yeah, they've set their ship. They've set the course of their ship. They're on board with all of it. The vaccines, the genetically modified foods, the 5G, like they're not stopping. And any reform is not going to come from within their system. It's only going to come from the people who realize what's happening. Because everybody with a brain wants to be in the little group. Everybody, every thinking person should want to be in the group that has no chronic illnesses.
So
Just
their
has the background.
argument. So let's say, I'm going to be, the voice of of the vaccine companies. Well, if you don't get these vaccines, you're going to die of polio. You're going to get polio. You're going to get, all these diseases.
Oh yeah. So we looked at that too. You can see my screen right now. It went to blue. Okay, good. So we looked at every single disease on the CDC schedule, and we found that for literally every single one, the vaccine was introduced after the infectious disease problem was solved. So here you have measles disease mortality. The remedy for measles is vitamin A. Once we figured out that it's vitamin A, nobody died from measles. Already it was a pretty low death rate. This is one death for every 100,000 people. Then the vaccine comes along in 1963 when the measles mortality rate was already solved, and it takes all the credit. For what? The death rate was already zero. And so you look at this, it's for everything. Diphtheria, whooping cough, that's pertussis. It's the same thing. The vaccine comes along, it takes all the credit for something that engineers already fixed. How did engineers do it? How did engineers solve the diphtheria and whooping cough problem? Decreased crowding in cities, refrigeration, of year-round access to foods, plumbing, better hygiene. We solved all these issues in the 1950s. And then vaccines come along and take the credit. There's polio, chickenpox. I can go into some detail on all of these calculations and how our expert team of PhDs figured this out. This is fascinating, Kelly. These are diseases that, yeah, go ahead.
So go ahead and give me some detail on this, because I think my audience is going to think this is as fascinating as I do.
So this trend that we see for diseases like polio, you see it's cured in the 1950s, cured in the 1940s and 50s. We should see it for other diseases for which there is no vaccine, correct? Because if these charts are correct, it should also apply, and it does. These are diseases for which there's no vaccine. TB, look at that, solved in the 1950s. Typhoid, solved in the 1940s and 50s. Scarlet fever, diarrhea, every single disease, we solved it in the 1950s without vaccines. Vaccines took all the credit. They stole it from engineers. This is we should be outraged that engineers solved it and vaccines and pharma took all the credit. That's outrageous. And yet here we are today suffering what? We're suffering look at this, massive increases in chronic illness, heart disease, cancer, stroke. These are the leading causes of death today. I use 1997, but it's the same today, these numbers. Massive increases. So basically, we traded very low rates of injury from chronic illness, from infectious disease, very low rates. Nobody was dying from polio in the 1960s or measles, nobody. And we traded it for what? Insanely high death rates and mortality from all of these chronic illnesses that you don't just die, you suffer before you die. You know what it's like to have diabetes for 30 years? That is suffering for 30 years before you die, if you make it that long. And so that is the vaccine program.
Wow.
There's no logical basis. And so there were some scientists who calculated what contributions vaccines made to reductions in certain diseases, like here's varicella. They say at most, vaccines save about 1% of lives from, meaning that if only 1 in 100,000 people dies, 1% of that one is related to vaccines. That means that you would have to show that vaccines injure less than 1 in a million people for them to have any benefit, or less than 1 in 10,000 have any benefit. Like those are the kind of numbers we're talking about. But my data shows how many people do vaccines injure? Is it less than 1 in 10,000? No, it's about 1 in 2. Vaccines injure every other person, meaning that if you get a vaccine, it might save 1 in 10,000 people, maybe 1 in 10,000, but your injury rate is 1 in 2, 50%. That's insane. It would be like somebody coming up to you and saying, I want to give you a saltine cracker. You're very lucky. I'm going to give you a saltine cracker. But in exchange, I'm going to hit you in the face 10 times with a baseball bat. You'd be like, that's a terrible deal for me. There's no way I would do that. It's the same thing with these vaccines. Any thinking person who looks at this data sees vaccines are not worth the risk. Frankly, it's not even close. And this isn't all the data that we looked at. Our MD PhD team, we also looked at the childhood schedule over time. So here it is. So the red is the total number of vaccines that you get. So this is the 1980s. That's my generation. And then you go up to today's generation. This is the 2000s up to the present 2020. And so the red line is how many vaccines you get, 77 vaccines for children today. The blue line is how many is the uptake rate, like, because not every child gets every vaccine, but it tracks it very closely. Okay, so that's part one. Now what we looked at was the chronic illness rate. So this curve, that red line is the same red line we looked at on the last graph. And this orange line shows the increase in chronic illness over time, as well as the trajectory into the future. The orange is children and the blue is adults. So what you can do, what our scientists did, is they compare the rate of increase in this red line to the rate of increase in this orange line and this blue line. And what you find, and that's called a Pearson correlation coefficient. And if the two match, if they're in harmony, they match like parallel lines, then it's called a perfect correlation. Parallel lines is a perfect correlation, or 1.0. Whereas if it's totally mixed up and there's no correlation whatsoever, that's a 0. What we found for chronic illness is that it's for the children, it's a 0.99 match, and for the adults, a 0.9 match, which is a very high correlation. So let me give an example. Imagine that your doorbell rings. There is a 0.99 chance somebody's at your door. There's a less than 0.1 chance that it was an acorn or some random fluke that your doorbell went off. It's the same with this. This correlation shows that it's a 0.99 chance that the vaccines are correlated to chronic illness. And we looked at multiple things, and you just see this over and over. Every single time we looked at it, it always came in as a very high correlation.
Wow.
Here's autism.
Huh.
Special needs. There's diabetes. So these graphs help emphasize that experts, objective experts who honestly look at vaccines, realize that they are first correlated and secondly causing chronic illness. So what
my question is why that's pretty impressive data. Okay. Have you sent this to anybody to look at in state and federal health agencies?
we did, we sent the data to all three branches of government. We sent it first to the president of the United States, along with 20 of his top advisors. What we did is we put together these very detailed presentation packets. They were so nice. We put them in nice red binders. We used glossy photos and put all of this together, even with an executive summary to the president and to top advisors who work in national security and in Congress and so forth. And it was crickets. This was all happening right at the time that COVID was starting, and they were just pushing hard for the COVID vaccine. And, we didn't get any response. So we filed a case in federal court and presented this information to a federal judge. And the judge said, you can't sue the president. You have to sue somebody else. And we later recused that judge we disqualified that judge because he owned over $500,000 in pharmaceutical stock, vaccine manufacturer stock. And so he stepped down and said, I reversed my orders and, I'm walking away from this case. Meanwhile, we were appealing to the Ninth Circuit and the U.S. Supreme Court. And that's where the stage we're at right now.
At the Supreme Court?
Yeah.
Wow. So what about there must be an association of pediatricians, American pediatricians. How about Europe? Have you been dealing with any of the health agencies overseas to get any support for this?
It's the receptive ears to this are, for the first time, conservative governors. So there are governors in different states in the U.S. who are interested in potentially doing control group studies, because what we want the authorities to do is verify our work. We are just such an open book. Here, we'll give you our data. Let's repeat the study. This is science. Let's just repeat the study, and you guys can see this for yourself using your own methods with your own official government stamp of approval. Whatever you want to do, because there's no way to hide this data. Like, it's amazing. All you have to do is you just look at the unvaccinated, look at their health records, survey them. It's amazing. Every single study that's looked at this data, the Paul Thomas study, the Mawson study, the James Lyons Wheeler study, every vax versus unvax study shows the exact same thing that I just showed you, Kelly, which is the unvaccinated are exponentially healthier than the vaccinated. The only question is exactly how much. Our data showed over 10 times healthier. Some data shows it's a little bit less, some shows a little bit more, but everybody's showing the same thing, which is exponential. So whoever does this first official vax versus unvax study is going to make it, it's going to sort of open the door to what you've highlighted, which is sort of getting it officially recognized. So our group, we did successfully introduce a bill in Congress through a congressman in Texas named Louis Gohmert.
Gohmert, yeah.
Yeah, he's good. And we had 9 co-sponsors, so 10 co-sponsors, so 11 congressmen, all support our study and data and idea, which is that we want to end mandatory vaccination throughout the United States. And we drafted a bill for this reason called the NICE Act. NICE stands for National Informed Consent Exemption. NICE, we want to be nice. And what it does is it does 2 things. Number one is it bans vaccine mandates everywhere. You can still get vaccines if you want them, but nobody can force you to get them. That means you get to go to work, you get to go to school, etc. Number 2, it provides a mechanism for entities like private doctors and survey companies to survey the unvaccinated and report to Congress in the next 4 years. This incentivizes the system, the healthcare system, to study the unvaccinated, to repeat what we did. We are so like I said, we're such an open book. We want to work with the authorities. We want this data to get out there and to be confirmed and recognized, legitimized, have multiple people doing it, do it from different angles, have some groups that do medical record audits. There's so many ways to do this. And the results we know show that the unvaccinated are thriving. They're thriving. It's like the 1950s. It's amazing. And so I think we're going to see soon, probably in 2023 and 2024, we'll start to see these governors stepping up and instructing their public health departments to do this work. And so the system will ultimately recognize this. And it follows the same timeline as tobacco, if you can believe this. Big tobacco, we take it for granted because we live, in this era. But there was a time when people debated whether cigarettes cause lung cancer. And you know what proved that cigarettes cause lung cancer? Control groups. It was so simple. But here's the surprising thing, Kelly, that it took, after the control group definitively showed cigarettes cause lung cancer, nobody could debate it. Nobody. It was only 10 years later that any change happened. Do you know why? Because cigarette companies debated it. They're like, no, we don't recognize the control group or any of this garbage. We just say cigarettes don't cause lung cancer. And they were just doubt. They're all about doubt. It took 10 years. Well, it's the same thing with vaccines. We've proved it. Other doctors have proved it. We're on like year 5 right now. So I'd say maybe in the next 5 years or so, all of this data will be recognized, validated, and systems across the world will change. The future is unvaccinated.
But do you have support from any medical associations like pediatricians or the AMA and if you don't, why?
Yeah. Multiple doctors groups have come out in support of this. Physicians for Informed Consent, American Association of Physicians and Surgeons, AAPS, anthroposophic medical societies as well. So there are physicians groups who are standing up and recognizing the validity of this. And especially so as we see new studies published on PubMed, which has that, .gov address, and that's very important. So this information is becoming more acceptable. It's becoming more mainstream in the sense that people are realizing, because of COVID, that public health authorities cannot be blindly trusted. And the only way that we're going to be able to solve this issue of vaccine overreach and infectious disease mismanagement is with control group studies. It's really the most powerful evidence. It always has been. The first control group that is really well documented in public health is a fascinating story. It involved a British scientist, and he was studying cholera outbreaks in England. Cholera is a waterborne disease. Mm-hmm. And what he found was that 95% of everyone drinking from well A or well number 1 had cholera. But nobody drinking from well B, with the exception of a couple people, had cholera. He's like, well, it's probably the well, right? That was the control group. And what he found is that the people in group B who did have cholera, they had walked over to well A and drank from well A. So it was obvious. He's like, well, I think that cholera is caused by this well. And he was laughed at. People said, where are you getting this? It's the same type of people who laughed at hand washing. The medical system has deep flaws, even in the face of obvious evidence of harm. They are slow to change. And even the California legislature recognized this with a bill. They said it takes up to 17 years for medical establishment to recognize when change happens. 17 years. That's 10. I remember I gave you the 10 years for tobacco, right? 17 years in medicine. So this is not easy. It's a long process, but history will vindicate the unvaccinated because, Kelly, it's truth. It's science. It's fact. And people just can't hide the light. They can't hide the truth. And so we're just going to keep pressing forward and getting this information into the hands of moms and dads.
Yeah, and I think that's a great idea because they actually are the movers and shakers. Really, if you look at all the big issues that have been overcome, it's because parents kind of stepped up and said no, Now I understand that tomorrow, I wanted to just kind of chat with you about this briefly. Tomorrow, I think the Vaccine Advisory Board is meeting to decide if they're going to put the COVID vaccine in the childhood schedule.
Yeah, yeah, it's they have many items on their agenda,
Yeah.
including other vaccines, and there already has been some approval of getting the COVID vaccine on the schedule for adults, and so the thinking is that there's going to be discussion on that item tomorrow.
Mm-hmm.
Yeah,
And
and so
if
many
that
groups are submitting.
happens, if that happens, then there's no suing the pharmaceutical companies.
That's correct. And already the pharmaceutical companies cannot be sued already because it is under this EUA status. And
Right.
everybody who's getting these vaccines, they're only getting the EUA vaccines. It's a label that they put on the vaccine vial, and it says it's an emergency authorized. And if you get that label vaccine, they put you in a special court. And again, you cannot be sued. The vaccine companies cannot be sued. And so once they start giving the FDA approved vaccine, the only way to get that legal protection is if the ACIP recommends that COVID vaccine be on the CDC schedule and CDC accepts ACIP's recommendation, which
Right.
is the ultimate rubber stamp. I mean, these government agencies, they know exactly what they're doing. So yeah, it's going to go before a vote. The ACIP will recommend it goes on the schedule. CDC will rubber stamp that recommendation and it'll go on the schedule because these people all work together. It's a revolving door between
Yep.
industry.
It is. It is completely. They work for the pharmaceutical, then they go to the FDA or the CDC, and they just keep going around and around. So that's one of the
And my
things,
court documents validate that. I should highlight this because our group did something really detailed that's very important. You know, I'm a lawyer and my job is to present evidence that is credible and vetted and recognized. So we put together the largest compendium of government documents proving that the vaccine industry is corrupt, that they don't follow their own rules, and that even the vaccine industry recognizes by its own data that vaccines are not worth the risk. We presented all of this to the court in judicial notice form, which is the CDC's own data. Like we use their own citations. And the court was so overwhelmed by the compendium of evidence. You know, like imagine, for example, I walk into your office, Kelly, and I put down just boxes of information proving that vaccines are dangerous. You'd be like, whoa, this is a lot. I don't know what to do with this. That's how the court felt, I think. You know, we almost proved too much. And so the court didn't know what to do with it. And they just said, well, we don't want to touch this. You have to sue the president, or you have to sue someone other than the president.
so that's still pending in the Supreme Court, though.
That is correct. And the reason why is because our evidence is so damning to the vaccine industry. Like there's only one person responsible for the national vaccine program. That's the president. He's the one who signed it into law. He's the one who manages it. He's the one mandating the COVID vaccination on certain people like healthcare workers.
Mm-hmm.
It's a national issue. A control group is national in scope. You know, there's not one person mandating. Like there's no one entity or agency we can sue.
Right.
So you know, so maybe the court will tell us that we should sue the CDC to get the order that we're requesting, but I don't think so. It's really the buck stops at the president.
So I want to ask you, I read this article, maybe you saw it. It's by Dr. Joseph Sanson. So, and it's titled, "Is Mark Zuckerberg liable for trillions in civil damages and should he be criminally charged?" Now, the whole premise of it is that Alex Jones, who you know, he's a talk show host, he actually has 22 million followers, which many would argue that he is a member of the press and he is a legitimate, media outlet. So this guy argues, and I want to read this to you because I want your take on it. It says media monopolies and big tech monopolies received $1 billion from the federal government to promote COVID shots and apparently censor information about the risk involved with the shots, thereby denying informed consent. It says, does this violate U.S. Federal law? And it says U.S. Code 21, Section 5023, 5024 required informed consent even for emergency use authorized experimental treatments. Informed consent is a concept embedded in Western medicine and is codified in the Nuremberg Code as well as the Declaration of Helsinki, which the United States considers itself bound. And he says Facebook enjoys immunity from civil liability because it is considered a platform, not a publisher. However, once Facebook engaged in censorship of medical information and potential harms arising from experimental gene therapy shots, it then began acting like a publisher and should be subjected to the same laws. What do you think?
It's an interesting legal theory. The idea would be that Facebook would be able to be sued privately for misinformation. I think Facebook's defense would be that they were just following the government narrative that, the CDC is going to be the authority on this, and they just, we're trying to protect people. That's going to be their big thing.
Is that a defense
but
of informed consent?
Kind of, yeah, because informed consent is set by statute. The way that Congress wrote it is that any person who administers a vaccine, as long as they give what's called a vaccine information statement, a little 2-page document produced by the CDC, that qualifies as informed consent. It's a super pro-vaccine document, but as long as you give that document, or in the case of EUA vaccine, an EUA fact sheet to the patient, and in Facebook's case, they always did that. Do you remember that little, anytime anybody posted on vaccines, remember, or anything COVID, remember how that little pop-up would come up? Say, for more information,
right,
visit the CDC. So, and that's where you find the vaccine information statement prominently featured. So, or EUA fact sheet in this case. So yeah, I think that would be their defense. I see that case as being, a winner in public opinion, but I'm not sure that it would win in a court.
But by not allowing people to put information that's contrary to the government and the pharmaceutical line, I mean, there's nothing there.
No, there is. I'm just not sure that one particular legal theory would be the winner. I would love to be proven wrong on that. I would say though that we are in a dangerous slippery slope with infringing on free speech. These like for example, Kanye West was just sued. Like this whole idea that Alex Jones was sued and lost money, like this whole idea that you're not allowed to speak, you're not allowed to challenge something, I think is very dangerous. And it's sort of this double-edged sword that people in the health freedom movement are trying to use against the government, and the government's using against people, private entities are using against each other. So this whole idea is that people are trying to weaponize speech. And that's, I think, a dangerous notion. I think the free marketplace of speech is much better. Where people say what they say, and we just we use discretion.
Have you had anybody say to you that what they've read of your control group, your survey data, that it's wrong, that it's bad, that has anybody stepped up to say that? It's like there's a guy, Dr. Steve Kirsch, or not Dr. Steve Kirsch. He offered up $1 million very early on in COVID for somebody to prove him wrong on his data. And nobody has yet taken him up on it. I mean, has anybody stepped up to say, no, you're wrong, and what you're putting out is misinformation. It's misinformation.
So far, nobody has stepped up to debate us, or to do like any type of critique of our evidence in the sense of like a line by line, give us a rebuttal, anything like that. There've been some blog posts from some of your favorite, hit people out there, right? Like the Dorit Reeses of the world.
What did they say?
They will criticize the same thing that I said that Fauci would criticize. This is a self-selective survey, and it's not a randomized placebo-controlled trial. And so if it doesn't meet pharma's gold standard, then it's just parents talking about their children.
Yeah, but how can it be how can it be a gold standard if they use a vaccine against the same vaccine to get approval? What kind of gold standard is that?
Exactly right, which is one of the key points, Kelly, in our court documents. We really wanted to get this information before a judge. And I think that's really before a jury. I think that that's going to be what success looks like in the future is getting this great evidence before a jury. We just have to present it in such a way that a court is willing to allow it in his courtroom.
Yeah. So just, we have a few minutes left here. I want to ask you about VSafe, the VSafe data. Are you familiar with that?
Oh yeah, yeah.
And
ICANN and Aaron Siri did a great job getting that. It shows what they did is. Would you like me to explain it?
yeah.
Okay. Yeah. So VSafe is a system or an app that the government produced in order to justify their COVID vaccine at warp speed. They said, normally we don't look at vaccine injuries, but for this COVID vaccine, because we're rushing it at warp speed, we're going to allow people to download an app. The app's called VSafe. You download it on your phone, and then you download it anytime. And then after you get the vaccine, we'll send you reminders and just ask you about your health status. How are you feeling today? Is there anything that you'd like to report? And so there were 10 million people who downloaded this app. And these 10 million people, all of them got the vaccine. All of them got, many of them got multiple vaccines. And the number, and 7.7% of them suffered a serious reaction where they needed to be hospitalized. Or, I'm sorry, they needed to go to the hospital for hospital care, which is staggering. No vaccine in history has that sort of numbers.
Yeah, that's almost 800,000 people.
Thank you. Yeah, and so and that is just on the form submission itself. That's just the checkbox. The CDC is still hiding data from ICANN. They're hiding the data of what's called the open field in VSafe.
Right.
So, for example, Kelly, imagine that you got the vaccine and you had stomach issues, and then pretty soon it developed into paralysis. Well, on the VSafe, it'll ask you questions, and then you look at your symptoms and you're checking boxes, but you don't see your condition listed on the very short list of boxes. And there's a little field at the bottom where you can type in what's happening. Oh, my doctor diagnosed me, I have paralysis, or I have myocarditis, or something like that. The CDC only produced the check boxes for VSafe. They're still hiding.
No.
Probably millions of people typed in detailed responses. I mean, think about the type of person who downloads an app like this, right? Number one, they're super excited to get vaccinated. Like, oh yeah, great, warp speed, let's do this, gonna get my vaccine. And then they get the vaccine and then they have an injury. Like, these are the types of people who really want to talk about their experience. Naturally, they're not going to be like, oh, check the box, done. All right, yeah, I'm injured, but who cares? I'm just gonna check a box and go on with my life. No, they're gonna type in some serious information into those fields. So fortunately, ICANN, one of my favorite organizations, they are still suing the CDC, and they're going to get that data. I don't know when they're going to get it, but when they get it, it's going to be a field day.
Was that part of their request? How can they?
Absolutely.
How can they not give it to them then? How come the court can't say, turn it over now?
I know it. The CDC has two excuses. Number one is the time and manpower it takes to review all of those fields. And number two is that in the process of reviewing those fields, the CDC will uncover information that's private. My doctor, James Smith, told me, et cetera. And so CDC has to redact anything that could identify the patient, like the doctor, maybe what area they live in, anything that could, and if you're looking at 1 million entries, then that could be a lot of work.
So also, obviously there's not a checkbox for death, but the person who was participating, if they died, the CDC is not going to follow up with their family, are they? And go, hey, how come we haven't heard from you?
That is correct. The app is specific to the phone or the smartphone.
Right.
So unless a family member actually accessed the phone and then filled out the report for the patient, for the deceased patient, the CDC wouldn't record that information in VSafe.
So that's I'm sorry to say this, but I think that's probably a big piece of information that VSafe is missing, right?
Oh yeah, yeah. It's true. It's really strong for recording injuries, including serious injuries, but not for deaths.
Right.
Yeah, for deaths, the CDC already has a system for that, and it is what happens is counties report directly to the CDC all death certificates, and then the CDC records those death certificates. They look at what's called all-cause mortality, anyone who dies for any reason, motor vehicle accident, diabetes, coronavirus, whatever the cause, it's called all-cause mortality. Then they also stratify based on what they think the cause of disease is, based on what the coroner writes for cause of death.
Right.
Yeah. And we could do a whole show on that because I think they are cooking the books hugely on death certificates.
So I understand that all-cause mortality is up all over the world for 21.
Yeah, because of the vaccines.
Well, that's what people are saying. And again, I don't, I'm not a scientist, but I've read a lot of articles about it, and it's all over the world. It's not just the United States, it's everywhere.
Yeah, because all the unvaccinated people, or all the COVID unvaccinated people, figured out how to treat COVID. You do ivermectin, you do HCQ, you do not go to the hospital. You do not go and get remdesivir. And so once everybody figured out what to do, then they realized how to live. And so they, how to survive this thing. And so the process meant that the unvaccinated weren't dying. And now that's the big issue. It's like, that's the elephant in the room. The unvaccinated are not dying.
Right.
It's only the vaccinated. And this was shown in the UK data, for example. It was like, was it 10 times?
Yeah, it was
10
a
times
lot.
the death numbers?
It was a lot.
Yeah.
And also, I think, was it Sweden or Switzerland also reported very, very high death rates.
Yeah. My go-to source for that data is Expose UK COVID data, and you'll find it.
Okay. Well, look, Greg, as always, you're fascinating, and I love the work you're doing. Look, what got you into this? I'm just kind of curious. What was the spark to do this survey?
Yeah. Well, I came to it from a constitutional law perspective. I realized very quickly that vaccines were the one medical intervention that people will force on other people. And the government loves that. The government, the powers that be, if they can force technology on somebody, then it's an open door. It's just like how the UN wants to tax us. They can find any reason to tax us, any doorway, it'll just balloon. It's the same with vaccines. So I realized we were going to lose our constitutional rights on this issue of vaccination. And the more I look at it, the more I see that vaccines are the worst healthcare choice a person can make in their life.
And so you just got together with other people who had like mind and
Yeah, I have a unique position, being the general counsel for a doctor's organization. I know which people in this movement, this health freedom movement, actually read CDC materials and pharma stuff, like actually read the stuff nobody else wants to read. I teamed up with those individuals, those MDs and PhDs, so that we could vet information and present the most credible information to a court of law. So our presentation, as far as I've seen across the entire world, nobody's ever done a better presentation to a court than we have. And they just dismissed it. Like, I think they were so scared of this compendium of information because it's so well done. It's so vetted. We have these great experts. Yeah, I mean, letting us into court is the most dangerous thing for pharma.
Right. Right.
Because they have no rebuttal. They have because they've never done a control group study, or if they have, they never published it. So they have no way to rebut our great evidence. And we're so reasonable too. We're like, just verify it, let's do it again. Let's, we'll work with you, so we're reasonable, we're vetted, and we just need to present it in the right court, apparently.
Wow. Well, Greg, I think it's great. And again, I just think the information is just unbelievable for any parent. I wish you could get it out to all the parents so they could take a look at it before they decide whether they're going to vaccinate or not. You know what I mean?
It's So you really highlighted it. I'm very encouraged these days that so many parents are realizing once they woke up with COVID, everything else fell into place. They're starting to question all the vaccines, starting to question mainstream narratives on other things. People are just
Yeah.
starting to make better choices for themselves, in terms of their health and diet and exercise and um, the kind of information that they think about. A lot of people are having a awareness moment.
Well, I think you're going to help contribute to that, and that's great. And I got to go right now, but I want to thank you again. Always, always very interesting. Keep up the good work, and I'm sure we'll talk again in the future. Thanks, Greg.